Do you wear one at the grocery store?
Absolutely not.
Deaths.
Far less.
4,521. Total cases, 301,000.
Last week in Florida,
hospitalizations increasing, 19,334. 54 hospital ICUs have reached capacity in Florida. Another 40 hospitals show that ICUs are at 10% or less availability.
Well, let me remind
and you say you're doing fine?
We're the nation's third largest state. So out of the 70,000 new cases we had last week, we had about 100 more people go to the hospital. That is a extremely small number when you're looking at the fact that we have 21.5 million people. Certainly not the sort of numbers that would drive people to shut down the economy.
Sir, you're the epicenter of a global pandemic, and you can't even admit that?
That's actually a false assessment entirely. And I don't even know what you mean by epicenter. The whole world's dealing with this issue right now. There's going to be a lot of cases in places of high population. Florida has 21.5 million people. Cases are going up. Everybody knew they were going to go up. When you open an economy, cases go up. Does that mean higher risk? Absolutely not. We have a very robust privacy clause here in the state of Florida in our state constitution, and it's supposed to protect all sorts of private information and liberty when it comes to a person. And we think it really violates this clause because this is something government's never done before. We've never had government tell you what you have to do with your own face. This is truly a novel move for government, and we think that it violates the bodily and facial autonomy sort of implied parts of the Florida Privacy Clause.
You said you don't wear a mask in a grocery store. Why would you not wear a mask in a grocery store? What is it that is a problem with the mask for you?
To repeat my point, if you're basically keeping a social distance from people, you're not getting too close, you're fine. You don't need to wear a mask on top of that.
That's not true. Do you know anyone who's died from COVID?
I am aware of people who have. No one very close or on a first-name basis with me have died.
Who are you aware of who has died?
Because I'm a state representative, I hear about the names of the people in my community who died, and sometimes people do know them.
And it's proven that masks save lives. Wouldn't you want to see their lives saved?
I think the importance of masks, there is some importance to masks. I think that the media is grossly exaggerated their effect in this in certain circumstances, to the point where people literally think if they have a mask, they're not going to get COVID, when it's just a drop in the bucket in terms of precautions you can take.
The media is repeating what public health experts are saying. I mean, just to be clear, you're not a doctor and you're not a public health expert, right?
Well, don't forget that just 2 months ago, these public health experts. Well, let me say this. 2 months ago, these exact same public experts.
You're not. I'll just answer it for you, but go on.
Citing with authority said, do not wear masks. What do you say about that?
What do I say? I say that at the time they said they were protecting healthcare workers, and I say there's been a lot of discussion about that initial recommendation, as there should be, Representative. But that's not mutually exclusive with what you are saying here.
Yeah, no, hey, listen, the CDC is going to recommend a whole lot of things. People should take those things with great interest, but they should not make those things something that if you don't listen to, you're going to be punished in the eyes of the government. You're actually going to be sent to jail, arrested, hit with civil fines. That's really what the lawsuits revolve around, the role of government.
Okay, and just to point out, so far in your cases, we're monitoring one loss at this point of a county that disagrees with you. You are not a doctor. You're not a scientist, Anthony Sabatini. Thank you for coming on.